Welcome to the Practice Leader Podcast, brought to you by Ascent, a show for medical practice administrators who feel stuck in the daily chaos and want to lead with intention. I'm Zed Williamson, founder and CEO of Physician Growth Accelerator.
And I'm Paul Richards, president of Ascent and director of otolaryngology at the University of Utah School of Medicine. Every week, we explore what high-performing leaders are doing in real time, so you can stop reacting and start leading with purpose, strategy, and results.
Survey after survey after survey to all employees in healthcare practices tend to come back with something on it all the time. And it's, we need better communication. And that's why we're speaking with our guest today, Jennifer McNamara. She's the CEO of Healthcare Inspired. She specializes in identifying and addressing documentation gaps that impact patient safety, compliance, and revenue. Jennifer, thank you so much for joining us today.
Thank you for having me.
Absolutely. So you're a little bit passionate about communication or lack thereof in healthcare. What are your thoughts? Why are you so passionate about this idea?
Well, in my 20 plus years, in the different roles that I've played in the healthcare system, starting from the front desk now to running my own company as a consultant, I've seen a lot of disconnects. I've seen it done right, of course, and I've seen it done not right, where it actually creates these gaps in the revenue process. And when you try to figure out where those gaps came from or try to fill those gaps, you realize that it all comes down to poor communication, whether it's someone didn't get the memo or didn't get the right code on the claim, or didn't really know how to interpret the documentation as a coder, the prior authorization itself, like not getting the details didn't get relayed in the way that it needed to be for that to be done efficiently and correctly. So it comes down to patient safety, but also even on the revenue side, communication plays a huge role across the industry.
So communication is one of these big words. Not only is it multisyllabic big, but also just it means a lot of things.
Mm-hmm.
And if someone is out there listening going, yeah, you know what, we don't have good communication, where does someone even think about starting in trying to fix that?
Well, it starts with just getting to know your team and how they tick. Regular huddles, we call them. And in the modern 2025 world, a lot of those take place virtually. And I think since the pandemic, we've had some issues with keeping those communication lines open with our teams. And, it's a necessity at times to work virtually these days, and it's helpful, but that can create a disconnect where we don't really know what our teams are going through. So having that open line of communication where we can feel like we can talk to our supervisors, we don't feel like they're too far above us, that their door is not always open. If they have a question, because the questions that are not asked are often the reasons why we see the delays in reimbursement.
Paul, I'm curious, in your experience, when you think of the word communication or lacking in communication, where have you seen that hit practices you've been a part of?
Yeah, the thought that comes to my mind is, and it's unfortunate, but the time commitment. Things are moving so fast, and I've been guilty of, like, I just don't have the time to just circle in with everybody, or walk the floor, or stop in, or see how someone's doing, or whatever. So I guess that's my kind of dilemma is I know it's a priority, but how do you maybe get that? Like, this is a top priority, that you make the time. You'll get better results if you just put the time in. But that's my conflict, is time.
When you hear that, Jennifer, what comes to your mind in working with teams and talking about communication? How does someone kind of wrap their head around what this means from a time perspective?
Well, it's time management, honestly. And sometimes we have a gap. And what I've seen in medical practices, because actually there was an ENT practice that I went to do a workflow assessment with, really just to help them understand their team dynamic. I met with all the physicians, I met with all of the revenue cycle people, the front desk, to get to know what are your pain points in your job from day to day. When you come in the morning, what is like the first thing that you do? So from a workflow aspect, that's important to understand what their day looks like. Are there things they're doing harder, not smarter? Are they not working smarter? Are there things that they need that they could be doing more efficiently, where the time could eventually be there for these things if we streamline some processes? There are still some practices that are operating in what I like to call the prehistoric era of healthcare. They haven't quite caught up to the technology that can make their lives easier, and so that can be an issue. But time management can be improved even in the very basic ways. And so we like to talk about that when I meet with them and discuss, for you, what does time management look like in your role? Because it's not the same for everyone.
What comes to my mind is walking the floor. You said those specific words, Paul, and I know the value of just being around, connecting with people. And a trick that someone taught me a while ago, and I did it for a long time until it became a habit, was I put a stack of pennies in my right pocket. And by the end of the day, I needed to have those pennies be in my left pocket. And the only way they got to the left pocket is if I would go out of my office, because I'm kind of one of those, once I get to work, I'm in the office, focus, headphones on, do work type of guys. And it was really breaking the habit and creating a new habit because it just was out of my mind. But I also know the value of being out and understanding where people are in their day-to-day lives. So, communication also, it's not only, the impact of, let's say, a lack of, but it can also be an assumption of. So you had mentioned something earlier related to, what someone thinks about asking a question to a superior, or what someone thinks about bringing something up to a superior. How much of a communication issue is created because someone's assuming that communication already happened or shouldn't happen, where we start telling these stories on the inside?
Well, honestly, I've seen it happen where that assumption is made and the claim goes out the door. The patient gets the information relayed incorrectly, or they miss about a vital piece of information that they needed. Maybe, like even on a basic safety level, they were given not a complete picture about medication management. Those are things that can, harm a patient. And then there's things on the revenue side where the full picture wasn't given, and the authorization sits at that person's desk for days and days and days until it's no longer available to be used, expired. Nobody knew about it because someone else thought it was already done, and there was no checks and balances in place.
It's funny because there's something called the curse of knowledge, where it's this idea that it's hard to forget what it's like to know what we know. So when we know something, it makes it harder for us to communicate it to other people. And I think that can be a challenge too in those situations you just said. To me, it might seem that I'm being very clear, but that's because I have this foundational understanding, these deep roots that go into what I know. And then I'm handing someone or something to someone who just doesn't have that knowledge base. And so it's not clear. Am I off base with that? Have you witnessed that impact
Oh,
practices?
absolutely. Yeah, I think that that's a true statement and a concept that is happening every day, where you have a different forms of knowledge that exist in different departments. They don't always meet. We talk about cross training because it's so important for you to transfer your knowledge to other departments. Not completely. I mean, I'm not going to be able to know exactly what a physician knows. I didn't go to medical school, and it's not like I have to have that full scope. But even as a coder, I have to know enough to interpret the documentation. So I don't have to keep going back and asking the same questions to the physician all the time. I can get in their heads without actually having to talk to them. So my knowledge is scope based, but I can still, ask those questions and be knowledgeable enough to make a decision. And that's where I think where the gaps are, is that there's different types of knowledge that exist, but they're not always transferred to the step that they need to be for the role.
Have you seen like where there's a culture maybe that the physicians won't listen to the coders or billers? It's like So the builder coder may be a little bit nervous to reach out and say, hey, you coded this a level 3, but you really probably should have done a level 4. And, right now, so I'm at the University of Utah, and we have a centralized billing team, and they will send out emails to our faculty saying, hey, um, you know, you should change this, or I'm noticing that you didn't do this right. And it's a pretty give and take, open communication. And most of the time, our physicians or providers will alter their note or documentation to support what the billers have come up. There's a credibility there that they trust. I'm just kind of curious the inverse of that, where it's like, I know what I'm doing. Don't tell me how to code. And like, how do you overcome that?
That's an interesting concept because I've seen it both ways. I've seen really strong teams that really understand each other and physicians that respect the role of the coder and vice versa. And I've seen it where sometimes physicians, they may think that I got this. And I do also work in the orthopedic spine area. There are a lot of specialists in that area that do have really great knowledge. They have great education to get on coding their specific surgeries, and they do understand that. And so we try to work with them on that and come to an understanding. What do they know or think they know that it's going to help me translate what I need to do my job? Asking questions, I saw explain to them what you're seeing in their note, because that explains to them what you know about it. And then from there, explain or ask, this is where I have to get to get this paid, and I can't seem to get there. Can you help me get there?
Mm-hmm.
And using them as your ally in the process. So this process can't work without the two of us coming together in an agreement. This is what I know from the payer. It's telling me I have to have this. I don't clearly see it on my end. Can you help me with that?
Yeah.
And so it's a partnership now, and it's not me telling you you're wrong, which is obviously the wrong approach. It's let's work together on this to figure out the best solution with accurate knowledge.
Right. My other thought is, it seems like crucial that if you're a smaller practice, or you employ your own billing encoders, that you keep them educated and up to date and going to trainings and all the latest, so that they're empowered to actually have that authority. I could see an issue where you don't invest in them and their time to develop, then the mistrust probably grows. So yeah.
Absolutely. And on the flip side, I'm just going to say this happens to us a lot on our side, is that a physician sometimes does go to a conference, but it's not a conference that discusses the revenue side as deeply. And they hear something and it sounds so great and sounds like, oh, we're making lots of money. And then they're like, oh, my colleague down the street's doing it and they're making lots of money. But I can't confirm that. And I have this information in front of me. I know the payer says this. I know this has to be documented. I know this isn't covered. It's in writing that it's not covered. And so you have to have those hard conversations, not to discredit what they've learned at their professional conference they went to, but that communication needs to be strong enough where they respect where you're coming from. And the other side, when you hear them tell you that, you don't just shoot them down. You explain, as a colleague to colleague, this is really where we need to come to an agreement on because of this. This is the reason why I can't just trust that. So you're not shooting down their excitement, but you're helping them come to the conclusion that we have to respect the reimbursement cycle and what information has to be relayed, regardless of what you've heard. This is the reality.
I really like that, because you're removing the me against you scenario, and just here's this thing we have to deal with, and we're actually shoulder to shoulder. It's beneficial for both of us that we deal with this correctly, and that removes that I'm right, you're wrong, I'm right, that kind of scenario. I'm curious, for the people who love coding, and we deal with a lot of stuff on the side of human behavior and personality, it's a pretty easy guess for me that the people who typically line up to love coding also are a little bit less social, generally, that I've seen. And so does that ever pose an issue where, this person has all the knowledge, they have the expertise, but if someone doesn't understand each other, like you had mentioned a couple of times, can someone just think that there's no communication, or think that, well, I always have to tell them what to do because they're not outspoken. Do you ever come across that?
All the time. Yeah, it's interesting. And there's this huge dynamic. I love coding. I'm very passionate about it. I'm one of those extroverts who loves coding, that can sit in the dark room and get it done, but also likes to be in the mix and educate. And I love to speak at conferences. I love to just like be with people. But there are also those that I know that they want to stay in that cubicle, or they want to stay in their home office and they don't want to talk to people. They just want to code. And that sometimes can make it difficult to have those conversations that need to be had. So when I'm training coders and I'm training physicians, even on documentation, trying to get them to meet and understand each other. But sometimes there is that they don't have that experience of communicating outside of their job. And so when they're put in a new role, for instance, maybe they're promoted, and then this promotion requires them to communicate on a deeper level with another person, it can be difficult. And they're strictly looking at data. And sometimes I think coders get put in this silo where there's data experts. This is not the computer coding kind of thing. This is medical coding. So it's a little bit different than just looking at computer code. And so that needs to be explained, that there has to be communication in this role, because you can't just always trust what's on the paper. Sometimes you have to have a conversation because you know that physician, and maybe this seems a little off today because they usually document this, but there's something that is amiss. And before I send this out, I need to have a conversation, because I'm sure that Dr. Smith would want me to ask him this question if it's going to help improve the reimbursement. I could just send it off as is, but because I know him and I know what he is thinking half the time, I think I better just reach out. And that's the problem that we have, is there's these assumptions that I only need to do this. This is my job. I can't deviate. I'm following an SOP.
Mm-hmm.
And sometimes the SOP needs to be put to the side to have a conversation. And that's what I think is missing in many cases.
Yeah. That proactive kind of, it's okay if it goes outside of the lines. We need to confirm there's no danger here. I'm not in any potential harm, right?
Right.
Well, Jennifer, I really appreciate the topic. I know you're passionate about it, and you wrote a book called Clear and Connected: How Effective Communication Builds Trust in Healthcare. So we'll put a link to that book in the show notes. And then also, you are speaking at the upcoming conference, the Ascent Conference, which is in Kansas City, September 9th through 12th. And your talk, Speeding Up Prior Authorization Without Sacrificing Accuracy, is definitely something that someone should check out. And if anyone has questions or they want to connect with you, is it okay if we put your LinkedIn in the show notes for them to reach out to you directly?
Absolutely. Happy to connect.
That's perfect. So we will do that as well for our audience. And Jennifer, I really appreciate you taking the time and spending with us in the audience.
It's been a pleasure.
Thanks for listening to the Practice Leader Podcast. If you're feeling the weight of challenges in your practice, know this: the problems you're struggling with today don't have to remain problems. There is a path forward, and you're not walking it alone.
Each week, we'll be here with insights, ideas, and real-world conversations to help you move forward from chaos to clarity.
See you next week.